Welcome here. My name is Dr. PJ Madam Rafi. Today we are going to discuss about anti-diuretics. So, what is anti-diuretics? By name itself, it is anti to diuretics. Diuretics will increase volume. So, these drugs will decrease urinary volume. So, main indication of this drug is diabetes insipidus. That is, increase diabetes insipidus is where patient is have uncontrolled urine. Okay, so they will have more volume urine loss. So, in those patients, we will use anti-diuretic drugs. So, before discuss about drugs, we will discuss about antidiuretic hormone. Okay, that is vasopressin. It is synthesized in hypothalamus and secreted to the posterior pituitary. Okay, so these are mainly secreted when this hormone will get secreted when increased plasma osmolality. Second one is decreased volume of ECF. Whether it is plasma osmolality increase or decreased volume of ECF, this antidiuretic hormone get triggered and it will get synthesized and secreted to the posterior pituitary. And this hormone will act to the three receptors, that is V1, V2 and V3 receptor. If it is acting on V1 receptor, it will causes vasoconstriction. Okay, so it will these V1 receptors. So this will be beneficial in treating of esophageal varices condition, variceal bleeding condition. So in those conditions, this V1 agonist will be beneficial. Second one is V2 receptor. V2 receptor is the main action of this antidiuresis. So in central diabetes insipidus, we will use this drugs. Next is this V2 receptor will have also one more action, that is releasing of factor 8. So it will be helpful in hemophilia and von Willebrand factor. So these are also blood conditions. So it will be useful in treating von Willebrand disease. Okay. And there is one more receptor, that is V3. Previously it was called as a V1B receptor. It will helpful in releasing of adrenocorticotropical hormone. Okay. So this vasopressin will acting on three receptor, V1, V2, V3. V1 will cause vasoconstriction, V2 will cause antidiuresis, V3 will have beneficial effect of releasing of ACTH. Okay. So what are the therapeutic uses of this one vasopressin? Vasopressin mainly used as a central diabetes insipidus, obviously, because central diabetes insipidus where ADH hormone will not be produced. So obviously it will be useful. So these are analogs. So they will be prevent excess urine volume, because vasopressin is a short acting and non-specific to receptor. It will acting on V1, V2 and V3. Okay, we don't need V1 and V3 effective. So we develop desmopressin. Desmopressin will have long acting, and more thing is it is specific to V2 receptor only. It will acting on V2 receptor. We need antidiuresis effect only. Okay, that's why we develop desmopressin. It will be acting on V2 receptor only. So nowadays drug of choice for central diabetes insipidus is desmopressin. Okay, if they are giving vasopressin also, we will go with desmopressin only. And one more indication is, that is drug of choice for nocturnal enuresis in pediatric patient. So in pediatric patient, normally bedwetting in the night time. So we will use desmopressin nasal spray to inhibit this nocturnal enuresis. Okay. And one more indication of vasopressin analog, those are lipresin, terlipressin, felipressin. These are useful in esophageal variceal bleeding. Okay, those are V1 receptor. Okay, V1 receptor causes vasoconstriction, thereby decrease vascular bleeding. That's why we will use in esophageal variceal bleeding. Okay, and there is one more MCQ also dependent on this area, that is lithium induced diabetes insipidus. We discussed this one in diuretics also, that is amiloride. Amiloride will be used in lithium induced diabetes insipidus. Among other than this drug, they will have some other drugs also, antidiuretic hormone high effect. Those drugs will be thiazide diuretics. They will be this in coming to diuretics group only, but they have mild effect, mild antidiuretic effect. That's why we they have asking chance of MCQ. Okay, thiazide diuretics, chlorpropamide, clofebrate, carbamazepine. These drugs having antidiuretic effect. Okay, so they can have chance to ask. That's why I am stressing thiazides. They will have diuretic and mild antidiuretic effect also. Okay. Next important topic here is SIADH. SIADH means syndrome of inappropriate antidiuretic hormone. That means where antidiuretic hormone is not secreted in the normal condition. It is secreted in normal euvolemia, that is normal volume, or hypervolemia. There will be excess volume. So in both conditions we don't need antidiuretic hormone. Normally antidiuretic hormone we need when the what is antidiuretic hormone condition? When body is facing increased plasma osmolality and decreased extracellular fluid. In those conditions only when you need ADA secretion, it will retention water. When body is having sufficient water, that is euvolemia. When body is having more volume, that is hypervolemia, in those conditions we don't need ADH secretions. Okay, in those conditions if ADH is secreted, that is called as SIADH, that is syndrome of inappropriate ADH secretion. What will happen? Obviously there will be more water retention, it will not absorb sodium levels, so obviously will end up in hyponatremia, leads to normovolemic or hypervolemic hypernatremia. That means if the volume will be normal or it may be increased combined with sodium, low sodium, that is hyponatremia. Okay, this is an MCQ. Normovolemic or hypervolemic hyponatremia or hypovolemic hypernatremia, they will ask. It will be hypervolemic, there will be more water absorbed but there will be less sodium. Okay, sodium will not get absorbed, so patient will have low sodium levels but increased water level. Okay, so how do you treat? Obviously fluid restriction, there will be sufficient fluid, so no need to give extra fluid there. So we have to cut down the fluid, that is fluid restriction. Next we have to correct hyponatremia by giving 3% sodium chloride, that is hypotonic saline. Third one is we have to reduce the volume, excess volume, by giving loop diuretics. Because loop diuretics, they will flush out excess fluid in the loop of Henle. So obviously one thing is we are not giving excess fluid, second thing is we are flushing out fluid, third thing is hyponatremia is correcting by 3% sodium chloride. Okay, so one more recently developed drug is Vaptans. These are vasopressin antagonist. Okay, when vasopressin antagonist, these are acting on V2 receptor. When V2 receptor, what is the effect? Antidiuresis. Okay, that means they are not flushing out fluid. When you are inhibiting vasopressin antagonist, that is V2 receptor, there will be more fluid flush out. Obviously fluid will get reduced, sodium will get corrected, patient will get treated. Simple. But sir, thank you.